Thank you very much. Okay. Between 2013 and 2018, 71 patients were treated in 72 procedures. The Israeli Ministry of Health approved focused ultrasound for all movement disorder in 2013. And from May 2018, we have reimbursement, so the numbers are bigger now. And this is what I'm telling you about, is a teamwork, single team, single center. The eligibility considered and the contraindication is medical refractory ET, tremor dominant PD. We treated also 1 case of MSA, 4 cases of ETPD, and we didn't treat any dystonia. All those patients had interference with daily activity. We treated the unilateral only, and we take care that they are not under anticoagulant and antiplatelet medication. All the patient has this battery of testing before and after. You can see that we test every patient with MRI and this battery a week after the treatment, a month after the treatment, 3 months after the treatment, 6 months after the treatment, and a year after the treatment. It depends on the disease, if it's Parkinson or the other. Here you can see the demographic of the patient, and you can see also the demographic of the patient in the Parkinson disease. You can see here that the skull density ratio was 0.31 to 0.62, and the maximum energy that we used was 36,000 joules. So there was 71 patients. All of them was free immediately from tremor immediately after the procedure. You can see the essential tremor before and after. It's very impressive, the decline in the scoring. And also with the PD, you can see the decline in the scoring on the UPDRS and the quality of life. We also treated 12 patients with concomitant leg, hand, and chin tremor, and we all succeed to treat them. In 54 out of 60 patients, 90%, who completed 3 months follow-up were satisfied. They were satisfied with the procedure. 51 patients has follow-up more than half a year. In 78%, patient has sustained tremor relief. In all but 2 cases, the recurrence of tremor was significantly less disable than before the procedure. When tremor recurred, we saw it in the first 6 months, not after that. In recurrence of tremor, we saw that there is a differentiation between writing and tremor, holding a glass or doing the regular activity. So sometimes everything, the tremor will not show in the regular examination, only recurrence in writing. This is the complication and the side effect. There is side effect immediately during the procedure, like vertigo and headache. And the main thing after the procedure is get ataxia. And this is another video that I can not show you, but this woman has a tremor before and also eye twitching. And after the treatment, the eye twitching was gone, the tremor was gone, but she developed unsteadiness, which gradually resolved within 2 to 3 months. I would like to emphasize this thing. You know that in the VIM, there is no homunculus. think about the homunculus when you are treating the patient, and the homunculus must be more bended, not in like this picture here, but if you go through the homunculus and change your target in sub-millimetric fashion, not in a millimeter and not in 2, but sub-millimetric, you will have less side effect and a good result. So identify different tremor component before, because sometimes in the tremor, when you check the tremor, there are also myoclonus and something like that. And after the operation, you saw that there is no tremor, but they have myoclonus and so on. So you need a careful neurological examination. And you still, if you look at the homunculus, you can treat the leg, the hand. Actually, you need to think about focus ultrasound like a pen in your hand. It's not like radio frequency. I'm saying again, it's not like radio frequency lesion. It's like a pen in your hand. And you can move it to different location that the tremor is. You can treat even one finger and stop the tremor in one finger, and you can treat it from the shoulder to the elbow, to the forearm, and the finger. It all depends how you move the target. And what we need is that other MRI scanner will be compatible with the system, that the treatment will be shorter time. There is a problem with head shaving. We need to find a solution for it. Thermometry stabilization, it's not yet perfect. And improving intraoperative MRI, and putting some electrophysiological intraoperative monitoring, especially when we want to treat the GPI, because the optic nerve is very near the GPI, not only considering the motor system. Thank you very much.